European medieval medicine, which spanned roughly from the 5th to the 15th centuries, was a complex and evolving field that combined ancient knowledge, religious beliefs, and emerging medical practices. The effectiveness of medieval medicine varied widely, with some treatments proving beneficial while others were ineffective or even harmful. Understanding the effectiveness of medieval medicine requires an exploration of its foundations, practices, and limitations. Foundations of medieval medicine. Much of medieval medicine was based on the works of ancient Greek and Roman physicians, particularly Galen. His theories on the four humours, blood, phlegm, black bile, and yellow bile, dominated medical thought. According to this theory, health depended on the balance of these humours, and illness was the result of an imbalance. The teachings of Hippocrates, particularly the idea that disease had natural rather than supernatural causes, influenced medieval medicine. However, this rational approach was often intertwined with religious and superstitious beliefs. Christianity played a significant role in shaping medical practice. The belief that disease could be a divine punishment for sin or a test of faith meant that prayer and religious rituals were often part of the treatment. Monasteries were centres of medical knowledge, where monks and nuns cared for the sick using a blend of herbal remedies and spiritual healing. Common medical practices. Herbal remedies were a cornerstone of medieval medicine. Many plants were believed to have healing properties, and some were indeed effective. For example, willow bark, which contains salicylic acid, a precursor to aspirin, was used to treat pain and fevers. However, the knowledge of which herbs were effective was often hit or miss, and dosages were not standardized, leading to variable results. One of the most common practices in medieval medicine, bloodletting, was based on the idea of balancing the humours by removing excess blood. It was used to treat a wide range of conditions, from fevers to headaches. While it may have had some placebo effect or limited benefit in reducing blood pressure, it was generally ineffective and could weaken patients, sometimes leading to worse outcomes. Medieval surgery was rudimentary but could be effective in certain cases. Simple procedures like draining abscesses, setting broken bones, and removing superficial tumours were performed with some success. However, surgery was extremely risky due to the lack of anesthesia and antiseptics, leading to high rates of infection and mortality. Like bloodletting, leeching was used to remove bad blood. Leeches were applied to the skin, and while they could effectively reduce blood volume, they were often used inappropriately. Leeching had some limited medical applications, such as reducing venous congestion in certain conditions, but it was overused and often ineffective. Effectiveness and limitations. Diagnostic methods. Medieval diagnosis relied heavily on the patient's symptoms, the examination of bodily fluids, and astrology. While physicians had some understanding of symptoms and their possible causes, their diagnostic methods were often flawed. Without a true understanding of pathogens or internal anatomy, diagnoses were frequently incorrect. Treatments and remedies. The effectiveness of treatments varied widely. Some herbal remedies and simple surgical procedures could be beneficial, but many treatments were based on superstition or incorrect theories. For example, treating epilepsy with ground human skull or attempting to cure plague with fumigation and prayers were not effective. Hygiene and sanitation. The concept of hygiene was poorly understood in medieval Europe, which contributed to the spread of disease. While some medieval hospitals were relatively clean and emphasized fresh air, many practices, such as using the same surgical instruments on multiple patients without cleaning, led to high rates of infection. Plague and epidemics. The medieval period was marked by devastating epidemics, most notably the Black Death from 1347 to 1351. Medieval medicine was largely powerless against such diseases. Physicians had no understanding of the role of bacteria or viruses and resorted to ineffective measures like bloodletting, the use of charms, and the burning of aromatic herbs. The high mortality rate during these outbreaks underscored the limitations of medieval medical knowledge. Medical institutions and education. Hospitals. Medieval hospitals were often attached to monasteries and were more focused on providing care and comfort rather than curing disease. These institutions were important for the sick and poor, offering food, shelter, and basic nursing care. While they provided compassionate care, their medical treatments were often ineffective. Medical education universities, such as those in Salerno, Bologna, and Paris, began to formalize medical education in the later medieval period. Medical students studied the works of Galen and Hippocrates, along with Arabic medical texts, which preserved and expanded upon ancient knowledge. However, the reliance on classical texts limited the advancement of medical knowledge, as direct observation and experimentation were often discouraged. Innovations and legacy. Arabic influence. The translation of Arabic medical texts into Latin during the 12th century introduced new ideas and practices to Europe. Arabic scholars like Avicenna, also known as Ibn Sina, and Al-Razi, or Rhazes, contributed significantly to medical knowledge, including advancements in pharmacology and surgery. Gradual progress. While much of medieval medicine was ineffective by modern standards, the period did see gradual progress in areas like anatomy, surgery, and the understanding of diseases. The work of medieval physicians laid the groundwork for the more scientific approaches that would emerge during the Renaissance and beyond. Summary of effectiveness. In summary, the effectiveness of European medieval medicine was mixed. While certain practices, particularly herbal medicine and basic surgery, had some success, much of medieval medicine was hampered by incorrect theories, superstitions, and a lack of scientific understanding. Despite these limitations, medieval medicine played a crucial role in the history of healthcare, preserving and transmitting knowledge that would eventually lead to more effective treatments in later centuries.